first of all, how was it after the operation? Did you have any major problem, something you did not expect before the operation, or you were not informed?
No,
No.
everything was fine.
Okay, this is the 5th day, and if you talk about the early post-operative period, I mean just 1 or 2 days after the operation, I mean how different it is now comparing to the first
I think the first hour after the waking up,
yeah.
I feel like vomiting,
Mm-hmm.
and after that I didn't feel nothing. Everything's fine because the treatment and with antibiotic, with the other liquids, let me feel comfortable.
Okay, okay. And how was the first night? Did you sleep well?
Yes.
Okay, good. And I warned you about the, actually, we were not talking about, to talk about the internal tightening. Actually, I was not planning to do that. I mean, yeah. But somehow during the operation, I realized that this would be, you know, good thing to do to make you, to give you a better look.
Yes.
So
yes.
we did not only the skin tightening, but deep inside the muscles are brought them together, so that your the belly would be slimmer, you know, and narrower.
Yeah.
So actually we do it normally with the female patient after pregnancies. They have these muscles split apart during the pregnancies. But for patients like you, I mean, having a bariatric surgery, you know, overweight people could, you know, have this problem as well. I wasn't expecting that, you know, I would be having to do that in your case, but somehow during the operation I realized that this is something, you know, I should be doing. I'm talking about this because I didn't actually warn you about the pain coming from this tightening, but somehow it seems that it did not actually change too much the postoperative period. Am I right?
Yeah.
I mean, did you suffer from too much pain deep inside?
No.
Okay. Well, the rest of it is something, you know, I did my best to get rid of as much fat as possible all around your body, so that, you know, it will be giving it, you know, the optimum, the best shape. Obviously, there are some areas that the skin already overstretched, so there is no actually way to tighten them up, like, you know, the skin here or somewhere on your back. So when it comes to skin, the only way to tighten skin is to cut some part of out. But in some areas, you know, I don't know how much it will improve itself, because even the overstretched area, I did liposuction on the knees, and I sort of scratched the skin from deep inside. So I'm expecting the skin a little bit, you know, shrinking, sort of contracting.
Yeah.
Well, maybe, you know, perhaps this part would be looking best because I did, you know, some skin cutting out here. But here as well, I mean, the area that I did not cut the skin out, I'm sure because of that stretching and then the liposuction on the knees will sort of stimulate the skin to contract a little bit. I'm not expecting, you know, to tighten it and smoothing it out, but somehow it will be looking better before the operation. So generally speaking, are you happy with the general treatment, the information beforehand, and the postoperative period?
I'm absolutely happy.
Good,
From
great.
the first day, arriving to see you.
Thank you.
This time, I'm expecting more from you.
Okay, thank you. I'm taking it as a compliment. So as for the final result, I've told you before in the previous video that it will take some time because the healing process is a big one, because it's an extensive surgery. I mean, it's not like nose surgery or neck lift surgery. There's a huge area that's being operated on. So I think, you know, it will take about at least 1 month, but in 2 months, in the end of, you know, second month, we'll be able to see what happened exactly. Okay? Until that time, the first 3 weeks is the absolute requirement to keep your garment on. But afterwards, if you feel more comfortable wearing the garment, you know, you're free to do that. But you know, if you feel that, you know, you feel better without the garment, you can just put on from time to time.
Yeah, I have another kind of garment.
Yeah, you will need a garment a little bit smaller than this one. Yeah, because as the swelling goes, the garment will be sort of feeling loose.
Yeah.
So when you go back, you can buy another garment like this, you know, but in order to buy, I mean, before buying this garment, I think you should give it a little bit 2 weeks, you know, or 1 week,
Okay.
so that the swelling will go, and then you will put something, the really fitting garment.
Yeah.
Whatever it is, the tighter the garment, the better. Because what we need from now on is just, you know, on your side, the patience. You should be patient, you know, because it takes, you know, every day better and better. But and the second thing is, from medical viewpoint, the more external pressure on the skin, the better. So that the skin, you know, will not allow anything underneath to accumulate, and the external pressure would help the contracting of the skin.
Okay.
Again, I'm saying that, don't get me wrong, that, you know, these areas will not be as, you know, the skin here, because I did not do any sort of cutting up skin here. So I'm relying on the quality of the skin to get contracted. I did my best to stimulate it, you know, to skin to get contracted, but the final result depends on, you know, the patient. In men it's better, in younger patients it's better, but, you know, in any of them I cannot say that it will be sort of the same level with, you know, like the tummy tuck.
Yeah.
So, good. Okay, it was about, what day? Just the 5th day, or what? The last Thursday. So today is the Wednesday, that means about the 5th day after the operation. So in the operation, as we talked about in the previous video, we did gynecomastia, we did abdominoplasty, tummy tuck, and the liposuction. Totally, I took about around 4 kilos, including the liposuction material and the abdominoplasty material. So after the operation, our patient stayed in the hospital for 2 days, and after the second day he moved to his hotel room, and since then I'm checking him on almost every day in the hospital. This is not something routine in every patient. It's the actually following up this drains. These drains are placed under the stomach. I mean the skin under the on the stomach, so that we will make sure that there will be no collection underneath, because that is one of the major problem. Not major, but, you know, the common problem if you just take this off too soon. So anyway, today is the time to take everything off and to make the patient free to move around. So, will you take your place? I'll help you with this. Oh, can I get the scissors? Shape markers. I'm just cutting the tapes. Huh? I'm not doing anything at all. So, you okay? Why are you closing your eyes?
To myself.
They're not surprised.
Okay. This is so. So I guess you'd better lie down so that I will be able to take the drains off. Okay. Bir süre lazım, bir tane etsin lazım. And then we will talk about how the last 5 days have passed for the patient, and I'll ask him if he had any difficulties. I just want his honest, genuine opinions about the post-operative time, I mean after the operation. And then we will be talking about his expectations before the operation and now, but it's too early to make any comment about the cosmetic results. So as we talked in the previous video, we will be, see the real result only in 2 months' time. So we asked the patient to send the picture or sort of video to us, so that we could make the real comparison between the pre and post-operative appearance. Well, this is the garment that he's been wearing since the operation, and this garment I placed just after the operation so that it will keep everything down, so he will not be suffering from too much swelling. So the drains are here, and that's it. The first one. On the drain holes, it will take about 24 hours. These holes to get closed is off. So now I'm taking everything off, and then he will be taking the garment off to give us the batikon alacağım buraya. Ya da bir küçük bir alet. On the 5th day, and it's so obvious that he's got some bruises and swelling. That's absolutely normal after the operation. And his incision line is here, and there are some, bumping areas here and there. That's, as I said, is something absolutely natural because we are applying some pressure. And naturally, at some point, the pressure is more than the others, like here and there. Because he's moving around, the pressure here is on the garment is more here. Now when I put the garment back, I'm going to put more pressure on it and less pressure on it so that it will get more even. And if it turns around, as you see here, oops, sorry. Okay, and this one as well. Okay, this is it. This one again will go, we will see in the long-term pictures or videos that, it will take shape on the way that, I tried to make in the operation. Okay, that's it. You can put your garment back now.